Do you think you can pass NCLEX within 18 days of preparation? Yes, you can, but you need to use the right material. 大家好，我要告诉大家要怎么样在18天内考上 NCLEX。可以吗？绝对可以。但是你要用对教材。When we were studying in nursing university or school, the teachers always gave us very thick books, very thick textbooks, and it doesn't have any main points. Don't you think so? The NCLEX determines if you can be a registered nurse or not. 在以前学校的时候，老师都会给你很厚的内外科教材，但是其实一点重点都没有啊。要怎么样考上 NCLEX 呢？最主要的就是用对教材。对 ，I strongly recommend this 学长的讲义 ，like that. Because of those two books, it's med search, and it basically covers everything. And right after I study those two books, my score on your assessment improved a lot. Basically, I would be able to pass NCLEX within only 18 days of preparation because of 学长的讲义, because of those two books. 那就是其实最重要的是那个教材嘛。那我非常推荐的就是这个学长的讲义。And later I will also tell something maybe is helpful for preparing NCLEX, like some topics and some easy way to remember. 我等一下也会告诉大家有一些就是 NCLEX 会考的比较简单一点的方式可以去记得。If you ask me, especially I'm actually just a nurse in Taiwan. Most of the people here maybe English is not their main language, so it might be difficult for many of us to pass or to prepare the exam just in very short time. But if you use maybe longer time, like maybe 3 or 4 months, especially the first and second months, you pay attention to remember the vocabularies, then it will be easy. If you have like 4 months of preparation, the first 2 months you try to remember the vocabularies, and the last 2 months to try to figure out the materials by sentence, not just to remember the words, but try to remember it by sentence. 如果像是台湾我们的母语不是英文，但是你可能会想说，怎么样才可以这么快考过？那你可以把时间拉长，像是可能4个月，前1-2个月就去记单词，后面2个月再依照你的那个教材去认句子，就是去学句子怎么念。我相信这对你会有帮助。And you need to have some kind of motivation. Why I want to be a registered nurse in America? The main reason for me is because I really want to marry an American husband and have kids being born as an American citizen. So it's become my motivation. So of course the work environment is also a lot better there. You have like 4 days off per week and you only need to work 3 days a week. Yeah. You need to find out why you want to be a nurse working in America. 那台湾的护理学生，我觉得如果你想要下定决心赶快考过 NCLEX 的话，你要问你自己，你考过 NCLEX 的动机是什么？这样的话，my motivation， 我的动机就是要嫁给美国人，然后希望我的小孩就是一出生就是美国公民，对 ，yeah. If you ask me 3 times, what's your main reason for going to be a nurse in America? The first thing I will say, because I want an American husband and my kids being born as American citizens. And the second I will say, yeah, I want an American husband and my kids being born as American citizens. And the third I will still say, I want an American husband and my kids being born as American citizens. And the fourth, you know the answer, I think. So you really need to find your purpose as preparing for the exam. 好，那如果你是台湾的，就是可能30-40岁啊，然后你在准备啊，你不知道说你准备这条路到底正不正确，那我跟你说，没有一条路是完全正确、完全不正确的。但是假如说你没做的话，你可能一辈子都会后悔。所以我建议，如果因为你可能现在有小孩，然后你有小孩的话，你就会想说，啊，我等40-50岁，我小孩长大一点再去美国好了。啊，你等到40-50岁的时候，你会说，我在等，我可能小孩之后要赶快结婚了，那我还是陪小孩就好了。所以，假如说你一开始就有这个想法的话，你要不要就直接去动手做，不要一直去问，不要一直去设想。你如果不做，你永远不会达到。And now I'm going to share something I found it very important to prepare for the NCLEX. So the first thing, I want you to remember 3 animals: lion, chicken, and fish. Lion, chicken, and fish. Why? Because when you are taking care of pregnant women, especially in hospital, when you see late deceleration, you need to do lion. What's lion? L, left side lying position. I, IV. O, oxygen. And notify the healthcare provider. If the patient has a late deceleration, you need to do that. But if the pregnant woman is having variable deceleration, it means the cord is being compressed. The cord supply the baby nutrients is being compressed. And what would you do? You need to do push position, push to make the cord not being compressed by the head or whatever, or the local cord, the cord just circulated around your neck, something like this. And if the baby's head is in your baby and is having the OP position, it's not OA, OP position. And you need to remember, O pain, very painful. So when the pregnant woman is so painful, what would you do? You need to do position push. Position the pregnant woman into chest knee position. Knee chest position. Then you push the sacrum area to do the counter pressure. And but you also need to remember, if the baby is just having the early deceleration, then you don't need to do lion. you only need to check the cervical dilation and effacement. And I also mentioned chicken, right? Because sometimes the question will ask you to choose which food the patient should eat, and you don't know what food to choose. And if you see the answer has chicken, you might need to choose chicken because it has higher chance of it has higher chance to be correct. Higher chance, not 100%, but higher chance, especially like grilled chicken or baked chicken, but not fried chicken. Fried chicken is bad. Anything fried is bad. Even like fried potato is bad. So, yeah, chicken. And I also mentioned fish. If the answer doesn't have chicken and the answer has fish, then pick fish. Yeah. And I will show you something I think might be helpful for you guys. Why I said fish. We'll see. It hydrates the banana. Okay. Why? Because salmon is fish. The least disease, least infection is caused by dairy products like egg, poultry, chicken. So it is caused by chicken. And the name has fish. So banana, I think it's easier to remember, maybe. And I also want to share like GMGG and GGGN. It's about the PPE, the protection gear you take on and take off, the sequence. How to remember that? I think it will be easier to remember if you are Taiwanese. Why? Because you need to remember G and N always tied together. G, N, gong, mask, gong, ma. G, N, gong, ma, ga, ning, lao, ma. In Chinese, in Mandarin, we say ga, ning, lao, ma means dog your own mother. So GM, GG, you need to remember the last thing is glove. And the third thing is goggles, the eye protection. But the last thing you wear becomes the first thing you take off. So glove become the first thing you take off. GM and gong, ma always tied together. So glove, the first thing you take off, the second thing you take off is goggles. And gamma. Yeah. Okay. And I also want to share the place I'm staying is a hotel. It's just right across the exam place I'm going to take 2 days later. So I think it's very convenient. It's called Just In. Yeah, and tonight it's quite cheap. So if the Taiwanese nursing student take the exam and they want to have somewhere to rest the day before or 2 days before the exam, I think the place might be good. Yeah, because I just came here. Yeah. And I'm going to stay here for 2 nights. And then and on 29th I'm going to take the exam. But I think I'm going to pass the exam, so I record this video. And I also need to share, you need to do something good, anything good, because I think karma really exists. So I think the reason, the way I'm recording this video will be also good because I'm doing something good. Because if you are preparing for exam and I share this material, and if I really help some of the people to pass the exam, yeah, it will be good karma for me. But I don't want a good karma. I just want my kids to have the good karma, basically. And if you ask me how to improve English in just a very short time, I would say you need to love the language first. If you don't love the language and you try to remember 200 different words, you will just forget it very quickly after you try to remember. And I also want to say, although those two books are really good, but some people might say, but I almost forgot everything the first time I read. I also forgot almost everything after the first time I finished those two books. 所以如果你看完这两个讲义啊，你忘记所有里面的内容，这是非常正常的。请再读第2遍，然后第3遍、第4遍、第5遍、第6遍。Because if you only read it one time, you are going to forget it very quickly. But if you review and review and review, you are not going to forget it. Okay? Okay. I think I still got some time, like 3 minutes. So I'm going to share something else. Like something about the test. Because many of us like to eat avocado, 洛梨, banana, 香蕉, maybe chestnut, and kiwi, 奇异果. But if the patient is allergic to any of those, what should you do? You should call the surgical unit, telling them the patient is allergic to those. Otherwise, the patient might have anaphylaxis. It's a very serious allergic reaction. And once anaphylaxis happens, you need to prepare epinephrine. How to use epinephrine? It's usually EpiPen. You need to store it under room temperature. And outer thigh. But the first thing, if the patient is allergic to like penicillin, and you need to stop giving the penicillin, stop giving something will cause the allergy, then you access the patient's lung to listen to the lung sound, and then you give the epinephrine. Inject into the right thigh, and hold it for 10 seconds. And if the anaphylaxis doesn't disappear, then give another shot 15 minutes later. Still outer thigh, and keep it for 10 seconds. Okay? And I think that's everything I want to share. And I set a time. Yeah. I hope the video will be helpful for you guys to pass the exam. And I'm sorry I don't have time to type anything like a Chinese caption or English caption. I don't have time, especially because I will post the video right after I know I passed the exam. I will not post the video before I pass the exam, and I will know I passed on August 1st or 2nd. So I will post then. But I have another exam on August 12th. So I really don't have time to edit the video. I need to say, I hope the video is clear enough for you guys, okay? 我没有时间做后置，很抱歉啊，我还有准备一些其他的笔记影片，我也没有时间做后置，因为我这个影片我等我考完之后，确定我有通过才会上传啊。我还有另外8月多的时候，8月1号、8月2号才知道说我有没有通过。可是我8月12号我还有另外一个考试，我真的没有时间做后置。但是这个假如说你就是在可能8、9月啊，你要考试，我觉得 这个你短期冲刺是很 OK 的，我觉得可以帮助到人。嘿，我希望大家可以把这个影片听完，因为我觉得最后半段这个也很重要哈。OK， 那祝大家一切顺利，也祝我顺利啦，拜拜。